I want to introduce Dr. Kyla Demers. She's graduated from the Athletic Therapy and Osteopathic School. She has worked with rugby, the National Circus School, and the Canadian Games and the Vancouver Olympic Games, and is recognized by the National Sports Institute of Canada. She's from Canada. Her current research aims... from our Canadian group. Her current research aims to provide insight into the role of osteopathy in concussion care. Please welcome Dr. Kyla Demers.
All right, can you guys hear me well in the back? No. What about now? No? What about now? All right. So first precision, I am not a doctor. I am not a doctor. I spent most of my life in school, but I am not an MD. So I'd like to thank Dr. Fitzgerald and the NORA organization for inviting me here today. I'd like to say that I'm sorry right away that some of these slides will not be exactly like you saw them, because I just finished my master's degree less than a month ago, and I was writing my thesis while I had to put this presentation together. So there might be a few French words in there that accidentally got in there, or a few turn of phrases that are not really English, and that's just because I was really tired. So I'm pretty privileged that I have lived or dealt with concussions from the 3 different perspectives. I'm going to share a little bit about myself here to start. So I've been playing rugby for 25 years, and so I have suffered some concussions, and these are pictures taken this summer. The top one is pretty fun because I got a black eye 3 days before my thesis defense on concussions. I've also been playing ice hockey for 15 years, and I was a competitive swimmer when I was younger. I graduated from the Concordia University in athletic therapy, your equivalent to athletic trainers, back in 2003. And then in 2004, I applied to do a master's on concussion at the University of Montreal, and they said, yeah, you can come to the University of Montreal, but pick another topic. No one's doing research on this topic. So I decided to do my osteopathy. And then after I finished my osteo, that lingering feeling of wanting to do research and help push the profession forward, and my passion for concussion was still there, so I embarked on the journey that is a research project. So you guys get to be the first ones, other than my scientific committee, to see the results of my master's degree. As a therapist, I worked with the provincial rugby programs for 15 years in Quebec, and I treat a lot of the national level athletes. I worked at the National Circus School, Cirque du Soleil. I was on the medical team for the Vancouver Olympic Games and some Canada Games, and I am a recognized therapist by the National Sport Institute of Canada. So today we're really going to talk about structure and function. So now we're seeing the word functional disturbance, functional problems, functional deficiencies in the definitions in our literature. So some of these slides you've seen over the week, so I'm going to go through them. So here, just a little review. We've got the physiological impact, and I really want to look at this last one. It was great. Paul went over it this morning. Now the literature is demonstrating a disruption in the autonomous nervous system. But that autonomous nervous system is in charge of a lot of things. And if we don't pinpoint that problem, we're going to kind of turn around in circles when it comes to our complex cases. So let's look at the mechanism of injury. So most of you in the room, your specialty is vision. My specialty is the whole body anatomy. So if we look at this mechanism of injury, we've got the neck that's getting affected. So the cervical spine, the muscles, the fascia in the neck, and the thyroid gland. In the thorax, we have the fascia, we have the thoracic spine, we have the diaphragm. If we look at the term fascia, we might include things like the pericardium, which is the bag of the heart that is attached to the diaphragm. The cranium, so if we look at the skull, we have a nice, Michael was nice enough to lend me his skull here. So we've got the brain, we've got the falx cerebri, the tentorium cerebelli, the cranial nerves. Autonomous versus central nervous system, all the vasculature. And then we have, of course, in the brain, our visual, vestibular, and proprioceptive system. So us as osteopaths and other manual practitioners, chiropractors, massage therapists, physical therapists, occupational therapists, we tend to look at this whole system as a whole. So my area of interest is the persistent symptoms. Okay, so some of the research has brought up new questions. Are the symptoms related to the metabolic, blood flow, or autonomic disruption? Brain injury doesn't necessarily cause the symptoms to persist, and our clinical symptoms might reflect more of a functional disturbance than a structural injury. So if we look a little bit, this is so when you do a master's degree or a PhD, you got to do something called a literature review. This was very fun. So finding rehab studies done for concussions. There are not a lot out there. Quatman and Yates in 2016 did a systematic review of all the physical rehabilitation interventions used to address persistent symptoms of a concussion. Out of a possible 3,437 titles, they retained 8 articles that had a good methodology. And they come up with vestibular rehab, manual therapy, or progressive exercise intervention. So we've seen these two. So we could see how the methodologies are getting better. 2010, Letty and his group published an article, case series, 12 participants, symptoms lasting from 6 to 52 weeks. Why did I keep this slide even though you've seen it before? Look at the few participants, look at the number of weeks post-injury. This is not a necessarily targeted population, and it's what I discovered with my master's, that it's very hard to do concussion research because it's very hard to find the participant that fits the exact profile that you're trying to investigate. But got better. This year published 103 participants between the ages of 13 and 18. They came in for their first assessment less than 7 days post-concussion, and none of them presented prolonged recovery. So his significant finding that the intervention group recovered in 13 days versus 17 days is a good result. It means we're onto something here. That's a really good methodology. Then let's move on to the manual therapy. So in 1990, Jensen and his group did a randomized control trial where they compared manual therapy to a cold pack, and they had significant findings. Next study, 2014, but great study from Karen Schneider out of Calgary, Canada. Karen is producing some really, really good research. She did a randomized control trial where one group got standard of care, so cervical range of motion, stretching, postural education, and the intervention group received vestibular therapy and or cervical manual therapy. And in 8 weeks, 73% had returned to play, were medically cleared to return to play, versus 7% for the control group. And they had a lot of outcome measures, so this is really great. So the literature doesn't necessarily demonstrate the benefit of manual therapy for concussions, but there is research out there that demonstrates the benefit of manual therapy to relieve some of the concussions that we commonly see in the symptoms that we commonly see in concussions. In 2016, there was another systematic review done by Morin and his group, again in Quebec, in Canada, where they looked at, they wanted to see the cervical spine involvement for mild traumatic brain injury, for the association between cervical sprain and symptoms of TBI, the mechanism of injury and the involvement of the C-spine, and the treatments applied. Again, 4,854 articles found, 43 retained. And what were their conclusions? That the PCS symptoms are not necessarily specific to the concussion, so we need to find alternative explanations that can explain these symptoms. Like we could see this weekend, vision is definitely a big one. That there might be a musculoskeletal component that contributes to the persistent symptoms, and that most of the research over the years has unfortunately been focusing on the diagnosis. And like the last presentation, I think it's up to us now to produce new research to show that what we're doing is going to help this population.